Last month, despite a very partisan environment here in Congress, 93 senators put their differences aside to vote in favor of a significant piece of legislation, which we hope will address many of the immediate problems facing the VA. It's an issue that Senator McCain and I and all of us in this room worked very hard on. I want to thank everybody for their support. It is my hope that that legislation and the conference committee that we're having with the House will be completed by the time we leave here for the August break. What is the relationship between space and the emergency that we currently have in terms of waiting periods?
I would tell you, Mr. Chairman, in every medical center I visited except one, and that's in Augusta, the number one constraint that they're operating under right now is space. Fayetteville, North Carolina, for example, is growing their patient population at a 7% annual rate. And when it takes us 5 or more years to get a building out of the ground, it doesn't take long to fall behind. So where we are today as a department is we're behind in terms of the space required today to serve patients. That there are $6 billion included in the $17.6 billion total that's designed for infrastructure.
And can you give us, what are those projects? Do you have them?
There are, and I'm going to ask Philip to go into some of the details, there are 8 major projects there. There are 77 lease projects for outpatient clinics that would add about 2 million square feet and roughly 4 million appointment slots. And then there are both minor construction and non-recurring maintenance that would add several million, roughly 4 million in round numbers, additional outpatient visit slots there.
We have heard time and time again that the dysfunctionality in terms of appointments for the VA has something to do with a significantly outdated program, a computer situation. Can you say a word on that, how you intend to improve that?
There are actually 4 parallel tracks underway right now dealing with the scheduling system. There are 11 existing defects in the system that are being patched as we speak. There are 4 different interfaces that are in the process of being developed to make it easier for schedulers to access and to actually provide the opportunity for veterans to be able to directly access their schedule. On the 11th of July, we led a contract for major enhancements to the existing scheduling system that will remedy many of the most egregious problems that we have right now that make it hard to deal with. And in parallel with all of that, as I mentioned in my statement, we are pursuing the acquisition of a commercial off-the-shelf state-of-the-art system. That's probably 2 years down the road in terms of actually having that functionality in place, which is why we're pursuing these other tracks in parallel.
All right, let me conclude. I've gone over my time. If we don't have the resources at the VA to address issues like hundreds of thousands of folks coming home with PTSD and TBI, space issues, what happens in years to come?
The wait times just get longer. We don't meet any acceptable standard of timely and consistent quality health care. I have committed to the President, I've committed to veterans, I've committed to the staff at VA. I will not hold back for asking for resources because we have not been managing to requirements as a department. This would never happen in the private sector. You'd never stand for it. You'd fail as a business if you did this. It makes no sense, and I will not. I'm not holding back now and won't hold back in the future. But I've also told these folks that have worked on these numbers, I don't want a penny in there that we can't justify, not 1 cent.
Okay, I've gone over my time, Senator Burr.